What steps, if any, do you think we should take to reform our healthcare system and bring healthcare costs under control?
Helen, your question has a couple of good parts. The first step, if any, is to stop this monstrous bill which is getting ready to be crammed down our throats in Washington, D.C. right now. So call every member that you know, Democrat, at any post that you know, in any county, in any state that you know, call them now and demand that this bill be stopped. That's step number one. Number two, the Republican Party has long been called the party of no. And unfortunately, the left has been very successful in branding us into the suggestion that we don't have ideas. In this case, the first and most important step needs to be stopping the push on this bill right now. The second thing that we need to realize is that the Republican Party has in fact offered some real solutions, and number one are market-based reforms. I've had a problem where I needed to get some knee surgery. I went out to the marketplace. It was very complicated to price, and after lots of phone calls and lots of mystery and lots of lack of transparency and opacity, I was able to find one clinic that would provide with the medical services that I needed, in this case a hospital bed and some anesthesia, for $1,500. I found a hospital that would only offer the same services for $10,000. That price difference, that 7 multiple price difference, is inherent of a number of different issues. Number one, the service that has to be provided to illegals. So right away we recognize that our hospitals are overburdened in that regard. Number two, tort reform and medical malpractice and the liabilities that in essence become a tax paid to attorneys. This is one of the steps that we have market-based reforms. Additionally, why is it that we can't buy a policy from across state lines? Why is it that we can buy our car insurance, but when it comes to medical insurance, we're limited? We all know, and as Republicans here, we're all capitalists, and we all believe that the free market and the market of ideas is the best way to find solutions, market-driven solutions. If we had more transparency, I would offer, with this healthcare monster that is about to be pushed down our throats, not only has this bill and the looming costs that it represents to employers, not only has it stifled any new job creation, and I'm sure we're going to get to the job creation here in a moment, not only has it caused hiring to freeze, it's also driven insurance company stocks to a 52-year high. I would offer that the quality of care in this country is exceptional. What we need to do are find reforms and some practices to in fact lower the costs. How do we do that? For those of you who are familiar, Bob Woodward, typically a left-leaning journalist, has pointed out, and now multiple members of both parties are starting to agree, that we need a bipartisan commission to actually explore where the real costs of health care are embedded. Because there's been so much political rancor over this debate as the Democrats have tried to foist this bill down, and then lobbyists from both sides have sprung up with tons and tons of misinformation. I would like to see a bipartisan commission actually explore the real costs and come up with some real alternatives to how these costs can be reduced.
I'm very close to this issue. My brother is a pulmonologist in Florence, South Carolina. I've watched him treat patients. I've hung around his office and watched how they document procedures. And since I've never stopped running, since my loss in the Obama regret that most of America had in 2008, I also was privileged enough to be invited by Dallas Woodhouse from the Americans for Prosperity to ride on the Hands Off the Healthcare bus back over the summer when I saw most of you when I came storming off the bus in Shalot, to do what I could to help defeat this healthcare plan. Congressman Duncan Hunter from California was supposed to be here this weekend and campaigned with me and for me all day. He's not going to be here. I don't want him here. I want him in Washington to defeat this health care plan this Sunday. That's where he needs to be, and that's where you need him to be. We have to defeat it, and I have a plan. My plan recognizes that Washington can't solve it. So I'm now calling for, instead of one plan, 50 plans. Senator Orrin Hatch pointed something out great the other day, and I agree. In accordance with the 10th Amendment of the Constitution of the United States, which is a states' rights amendment, it's time for the states to solve this problem, not your federal government. If the states want to solve it, fine. If they want to push it down to the counties, fine. But this is not a federal issue. It's a state issue. It's time for them to solve it, and in the process, it's time for us to save $300 billion by transferring the responsibility of the Medicaid program from the federal government to the state government. Cost reforms are also huge, as Warren Buffett recently has pointed out. Two big things that stick out: tort reform, obviously, and increasing the amount of doctors by building more medical schools. But we got to come up with a solution. Thanks.